I'm Diane Green. I'm the lead COPD nurse and service manager for St Helens COPD and Rapid Response Team, and we're employed by Mersey in West Lancashire Teaching Hospital.
My name's Stacey. I am the care coordinator for the Warm Homes for Lungs project and also the St Helens COPD Community Hub.
My name's Cathy Daly. I'm a commissioner manager in NHS Cheshire and Merseyside ICB in St Helens Place, and I'm the respiratory lead and also the project lead for the Warm Home for Lungs project.
Initially was called the Fuel Poverty Project, but in St Helens locality we decided to call it the Warm Homes for Lungs project and just bring it a bit more real around what it is for the patients themselves. It was identifying patients through using a system called GraphNet to identify patients diagnosed with COPD who have increased admissions over the previous 12 months with their condition, who are living in the 10% lowest deprivation area that they come from, and also have a quintile 1 of fuel poverty.
So we started the project in February, so it's been going for around 7 months now. It's a lot of project management work, so getting all key stakeholders together to obviously progress with a lot of the projects, getting all the right stakeholders in the right room at the right time. We've been working across health and social care, so there's Mersey and West Lancs Community COPD team, we've got the St Helens Council Affordable Warmth team, we've got Tourist, the Housing Association, there's Energy Projects Plus, there's also Mersey Care Pulmonary Rehab team, and the list will go on because we're always learning about new partners that we need to liaise with and really building those relationships to try and get that best outcome for the patients.
Changes have really involved us having a care coordinator in the team, and the changes on how the staff think about what they're asking the patients and how they're identifying patients. Then our care coordinator has identified if they live in social housing or privately rented or private accommodation and what sort of support they have around their living, asking them about, do you have any worries or concerns about paying your bills? Is your home cold in the winter? Do you suffer from any loneliness or isolation? These are the kind of questions that we've never really asked the patients. It's more been about their health rather than their environmental situation.
The person that is pivotal to this is the care coordinator. She really coordinates the care across the board. When she speaks to patients, she speaks to them like on a similar language as the patient, so that's why she gets sort of the best outcomes.
So you're the navigator that Diane was talking about?
I am, yeah. Some of those patients are known to us, some of those patients aren't. The patients that are known to us, we've got that relationship. The other side to it where they're not known to us, it is trying to gain that trust.
Some patients were very sceptical. You know, we're ringing up and saying, hi, can we get somebody from the council to come and see you? Can we assess your finances?
I've had people put the phone down on me. I've had people say no. They don't know who I am. I can count on one hand the amount of people that have done that. But then we've got other people who are saying, you know, what you're doing is absolutely amazing. We've had people in tears. And people do think it is too good to be true. You've got someone phoning you saying, you know, we're here to help you, and you can understand why people would have barriers up.
She's spoken to all the patients at grassroots level and being able to really get involved and really understand their needs on an individual basis. It really has helped for us to identify the needs of the patients and reassure them.
There's a lot of things that we can help with that patients don't know about.
Things like, are they going to bed at night worrying if their boiler's going to make it through the night? Are they freezing cold because they've got no insulation or their bedrooms are full of mould? I've had patients say they've had to choose between having their oxygen on or paying their electricity bill. Some patients go upstairs to bed at night, normally in the dark, and when they switch their light on, the bulb's broke. The increase in household, fuel bills is the internal stresses that do add to patients' ultimate health status and health problems.
We work very closely with other partners who are part of this project who, You know, we are all there to help with like social prescribing and things like pulmonary rehab and telehealth and anything to help the patients, then that's what we do.
So we try and alleviate those as much as we can. We offer them all light bulbs, we offer them draft excluders, radiator reflectors, and then they also are looking at doing financial assessments on the patients to provide them with a £500 household fund. And then the social prescribers identify all sorts of needs: smoking cessation, weight management, isolation, referral on to other charities that can support them. So it really is tailored not just to the patient but to their families as well. So it does enhance the lives of everybody involved in the Affordable Warm Homes for Lungs project that we deliver.
It's such a big opportunity to be the driving force of this project that we are doing. It has worked so well, but the key to it working so well is the relationships that we are able to build with these patients. The outcome of it, like they're so grateful for what we are doing, and to be part of that, it's just, I mean, it's amazing.
So in terms of the benefits that have been realised, the top one is helping those patients that are in need in fuel poverty. The second one is in terms of the collaboration with all of the stakeholders across health and social care. The other benefit is having access to that GraphNet dashboard and the ability for the community COPD team to be able to access those patients and then to provide coordinated care holistically across health and social care.
We go through GraphNet, we put in a value of filters that will bring up a population of patients, and then you can drill through and it identifies the patient list. And then you can literally then drill through from one patient to a specific patient. And then, boom, at the click of a button, we have all the information, the patient details, what quintile of poverty they're in, whether they're smokers or non-smokers or ex-smokers, what other comorbidities they have, how many hospital admissions they've had, what medication they're on, whether they've been immunised or need vaccination. And all this information is just there for us to then quickly review our patients.
It saves a lot of digging, and it's so easy because every bit of information that I need is on, well, 90% of that information is on one page. So anything from the history of the patient, could be hospitalizations, medical history, medications, vaccine status, that's all on that page. So I've got the majority of the information that I need in front of me.
We have given 82 patients the 500 household fund. 106 or 100% of our patients have all been referred to the Affordable Warmth team and the Wellbeing Service. We've had patients say to us that we've transformed their lives. We've had a gentleman who had a wife and daughter who suffered from mental health, who has had new windows, damp course done in the house, mould has been treated, the walls have been replastered. They had a hole in one of the floors in their bedroom, so the daughter was actually sleeping with the mother and the husband was sleeping on the couch downstairs. That's now been rectified and the girl has her own room and the husband's now sleeping back upstairs. And since that intervention, he had had 3 previous hospital admissions, and since the intervention has had none. Another patient who had mould in the house, their children refused to visit because of the mould on the walls and the state of the property. And they now visit regularly because all that work's been done. Patients are so grateful. We're just at the tip of the iceberg. We've had patients say to us, I didn't believe it because this is too good to be true. It's just been a different approach. It's given the team more insight into the internal stresses that patients have. As community nurses, we've always been very privileged in what we've been able to do, but this is definitely a step up from what we're told is proactive care. This truly is proactive care. This is holistic and looking at the causes of hospital admission. And one of the causes is patients living in a cold, damp home with financial constraints. and financial worries. So now by giving them holistic care, the patients can keep their houses warm, they can buy healthy food, which increases their health status and improves their overall quality of life. The impact that this can have, if this is funded right or put in nice guidance, that this is something that should be done for all of our patients, then I think this is the way forward that all clinicians should go, and definitely especially for patients with respiratory disease. Plan it in advance to everything that you do. The communication is key. To think about the communication and the comms that you're going to deliver first.
The person that is pivotal to this is the care coordinator, as she really coordinates the care across the board.
Your care coordinator is just the most important thing that you can have to deliver this service, ultimately to guide the patient through the journey and make sure that all the referrals are done and completed, and also to navigate for patients. It's all very well as a clinician say to a patient, you need to go and have your immunisation, but the patients aren't able or equipped to be able to find where to go and has it been delivered and has it been done. So, a care coordinator, I prefer to call them care navigators really, because they are there to navigate care, but to navigate other things that will help the patients.